गुड आफ्टरनून एवरीवन। आज आपका एक्सपेरिमेंट होगा द इफेक्ट ऑफ एड्रेनर्जिक एगोनिस्ट एंड एंटागोनिस्ट ऑन दी आई, और दूसरा है द इफेक्ट ऑफ कोलिनर्जिक एगोनिस्ट एंड एंटागोनिस्ट ऑन आई। नाउ व्हाई डू वी हैव टू नो द इफेक्ट? We have to know the effect for the diagnosis of any disease, any treatment of your glaucoma. Now what is glaucoma? Glaucoma is the intraocular pressure rise in the eye. We can't perform this experiment on animals. Earlier we used to take the rabbit, but nowadays we can't use a rabbit, so we are going to use the B.Pharm series software. Everyone got that? Yes, sir. Now, for using this software, you have to log in on the internet. You have to type B.Pharm software on the Google, and then you have to write the username and password which we have given you. After that, a list will open. The list will show different experiments, and you have to find the effect on eye of adrenergic agonist and cholinergic agonist. After that, when you click on it, there is a play button. You will click on that, and you get a window which will show that these are the list of drugs. I have written some example here, like for the adrenergic agonist, epinephrine and phenylphenol, and for the adrenergic antagonist, timolol and sotalol. Same for the cholinergic agonist, we have written pilocarpine and neostigmine, and for the antagonist, we have written atropine and hyoscine. First, we have to discuss what are the receptors that are going to bind with them. We have to remember that iris muscles contains these receptors, which is beta 1, alpha 1, alpha 2, muscarinic 1 and muscarinic 2. In this, your beta 1, alpha 1 and alpha 2 are your adrenergic receptors, and your muscarinic 1 and muscarinic 2 are your cholinergic receptors. What is the natural agonist? Does anyone know? But what is the natural agonist of these receptors? Okay, no problem. Adrenergic natural agonist is norepinephrine. It is naturally synthesized by your adrenal gland and your neurons. And cholinergic natural agonist is acetylcholine. It is also synthesized by your neurons. Everyone knows that? Yes, sir. But we can't use the natural agonist in the animal. We have to use some synthetic preparations. So I have written some example here. You have already known this. Now let's discuss the effect on the eye. Here is a rabbit, a diagram of it. And you can see the eye is located here. Currently the eye is in normal condition, and the IOP is also normal. What is IOP? IOP stands for intraocular pressure, the amount of pressure that is given by aqueous humor in your eye. Aqueous humor is your fluid in the eye. Okay, I have written some words, mydriasis and mitosis. Now what is this? Mydriasis means pupil dilation and mitosis means pupil contraction. So आंखों की पुतलियां बड़ी होना is mydriasis, and आंखों की पुतलियां सिकुड़ना is your mitosis. Okay, it is not the mitosis which you study in cell division. It is a different thing. Here I have written adrenergic agonist. Example is epinephrine. Now if you see your screens, you will see that epinephrine is listed drug. You can see that number 1 is written epinephrine. Yes? You have to click on number 1, and now you have to choose your eye, which is right or left. Suppose you are choosing right eye. Right. Yeah. Now type number 1. You can see that your eye size is changed. In the right eye, the pupil is dilating. What does this mean? It means that your epinephrine is giving you a mydriatic effect. So that means your alpha 1, beta 1 and alpha 2 receptors are getting stimulated by epinephrine. That's why your pupil are dilating. Okay. Now suppose I am giving you a antagonist, timolol and sotalol. Timolol and sotalol both exclusively are your beta blockers. They do not have any effect on your alpha receptors. Okay. When you choose timolol or sotalol, suppose you are choosing timolol and you are adding it in your left eye. Previously you added it in your right eye. Now you are adding it in your left eye. The effect will be your myotic effect, in which the pupil size is contracted. It is due to inhibition of beta 1 and beta 2 receptors. Please perform this. Select number 5. Press any key. Press yes. Y. Yeah. Now type number 5. Now type R. Now type 4. Yes. It is written that light reflex and intraocular pressure is decreased in both. Yes? Yes. You can see that. So what does it mean? It means that beta blockers also decrease your intraocular pressure. Timolol and sotalol comes in eye drop preparation in market, which is given for glaucoma. Both of these come in eye drop preparation for your glaucoma. In Hindi, glaucoma is known as kala motia bin. Okay. Now let's come to the second topic, which is the cholinergic agonist and antagonist. You see, pilocarpine and neostigmine do not have a direct effect on these cholinergic receptors. These are more like potentiators. Potentiators. Now what does this mean? Potentiators means that the effect of acetylcholine will increase, not the stimulation of receptor will occur. So that means that acetylcholine will stay longer than usual. Okay. You can see here that adrenergic agonist gave you a mydriatic effect and adrenergic antagonist give you a mitotic effect. Cholinergic agonist and cholinergic antagonist will give you a just opposite effect of this. So if I am giving rapid pilocarpine or neostigmine, it won't have a mydriatic effect, it will have a mitotic effect. It is only due to increased potentiation of your acetylcholine. So I will write here that will give a mitotic effect. Mitotic means the constriction of your pupils. Neostigmine and pilocarpine are usually also given for your glaucoma. This timolol and this pilocarpine comes in a fixed dose combination of eye drops. Lastly, I will discuss the cholinergic antagonist, which will directly inhibit your muscarinic receptors and your acetylcholine won't bind on them. Got it? What we'll do that we'll take atropine and give it in the rabbit's eye, right side, and the effect that will become is your mydriatic effect. So I write here mydriatic effect. Now what is mydriatic? Mydriatic means pupil dilation. We have discussed that mitotic effect is for your glaucoma. Yes? And glaucoma is a disease. So what is the role of mydriatic? Why are we doing mydriatic in eye? Can anyone tell me? No, IOP is only decreased in mitotic effect. In mydriasis, IOP is not decreased. Okay, nobody knows. It is used for your